Hi, welcome back. I'm so glad you're here with us today because we are diving into a topic that I get asked about constantly, and honestly, it's one that doesn't get nearly enough attention. We are talking about fibromyalgia in the hands. Specifically, what it feels like, how it's different from arthritis, why your hands are so deeply affected, and most importantly, what you can actually do about it. Now, if you've been dealing with hand pain, burning, tingling, stiffness, or that awful feeling where even picking up a glass of water feels like a challenge, and you've been told your x-rays look normal, or maybe you've been bounced from doctor to doctor without a clear answer, this video is for you. You are not imagining it. You are not crazy. What you are experiencing is real, it has a name, and today we are going to talk all about it. Here at this channel, we talk about all things related to chronic pain, fibromyalgia, autoimmune conditions, movement, mental wellness, and nutrition because we deeply believe it is all connected. And fibromyalgia is honestly one of the best examples of just how connected everything in our bodies truly is. So if this is the kind of content that speaks to you, if this is what you've been searching for, please make sure you hit that subscribe button, give this video a like, and share it with anyone you know who is suffering from fibromyalgia or unexplained hand pain. It really does help us reach more people who need this information, and that is truly why we are here. Alright, so let's get into it. These are the top 5 facts about fibromyalgia in the hands. Let's go. I'm going to walk you through 12 of those hiding places, symptom by symptom, with real patient stories, real data, and the exact questions to ask your doctor before your next appointment. And if you want my symptom map that connects all 12 areas, type symptom map in the comments and I'll drop the link directly. Fact 1. Fibromyalgia in the hands is not the same as arthritis. Okay, so fact number 1, and I cannot stress this enough, fibromyalgia in the hands is not the same thing as arthritis. And I know that sounds simple, but you would be surprised how many people, including unfortunately some healthcare providers, confuse the two or treat them interchangeably. And when you treat them interchangeably, you end up not getting the right treatment, not getting the right support, and honestly feeling more frustrated and more confused than when you started. So let's clear this up right now. Let's start with what they have in common because they do share some features, and that's actually part of why the confusion happens. Both fibromyalgia and arthritis can cause significant pain in the hands. Both can cause stiffness, especially in the mornings when you wake up and your hands just feel like they don't want to cooperate. Both can lead to weakness in the hands, that kind of reduced grip strength where opening a jar or turning a doorknob becomes genuinely difficult. Both conditions can make everyday tasks feel exhausting and frustrating. And both conditions can be associated with fatigue, which is something that often surprises people. They think, well, it's just my hands, why am I so tired? And the answer lies in how much energy our bodies use just dealing with chronic pain. So yes, on the surface they can look and feel quite similar. And that is exactly why people get confused. But here is where they are fundamentally, critically different. Arthritis, whether we are talking about osteoarthritis or rheumatoid arthritis, is a condition that involves actual structural changes to the joints. With osteoarthritis, the cartilage in the joint wears down over time. With rheumatoid arthritis, the immune system is actually attacking the joint lining, causing inflammation, swelling, heat, and over time structural damage. In both cases, if you take an X-ray or an MRI of the hand, you are going to see something. You are going to see joint space narrowing, bony changes, erosions, inflammation. The damage is visible. It shows up on imaging. It is a structural, anatomical problem. Fibromyalgia is fundamentally different. Fibromyalgia is a condition of the central nervous system. It is not a condition where your joints are being damaged or destroyed. It is not a condition where your cartilage is wearing down or your immune system is attacking your joints. What is happening with fibromyalgia is that your nervous system, specifically the way your brain and spinal cord process pain signals, is dysregulated. The volume on your pain signals is turned up way too high. So things that should not hurt, hurt. Things that should hurt a little, hurt a lot. And this amplified pain signal can manifest very strongly in the hands. So when someone with fibromyalgia comes in and says my hands are in agony, I have burning, I have tingling, I have this crushing aching pain, and we take an X-ray and the X-ray looks completely normal, that is not us saying the pain isn't real. The pain is absolutely real. What it means is that the source of the pain is not in the joint. The source of the pain is in the nervous system. And that distinction matters enormously because it changes everything about how we approach treatment. Now, how do doctors tell them apart? Well, a few ways. First, as I mentioned, imaging. With arthritis you see changes. With fibromyalgia the joints typically look structurally normal. Second, the pattern of symptoms. Fibromyalgia tends to involve widespread pain, not just the hands. There will usually be pain in multiple areas of the body: the neck, shoulders, back, hips, legs. Whereas arthritis, particularly in its early stages, may be more localized. Third, the nature of the pain itself. Arthritis pain tends to be more of an aching, throbbing, joint-specific pain. Fibromyalgia pain in the hands often has a very distinct quality. It can feel like burning. It can feel like electric shocks. It can feel like your hands are hypersensitive to everything, like even a light touch from a piece of clothing can feel uncomfortable or even painful. That hypersensitivity is a hallmark of nervous system sensitization, and it is very characteristic of fibromyalgia. There are also blood tests, specific markers that can help identify rheumatoid arthritis as a cause. Things like rheumatoid factor, anti-CCP antibodies, inflammatory markers. In fibromyalgia, the blood work typically comes back normal, which is again another reason people feel dismissed. Everything looks normal but they feel anything but normal. Fibromyalgia also has its own diagnostic criteria involving widespread pain lasting more than 3 months, along with other characteristic symptoms, and a thorough ruling out of other conditions. So the bottom line for fact number 1 is this. If your hands hurt, if they burn, if they tingle, if they feel stiff and weak, and you've been told everything looks normal on your tests, please do not let anyone dismiss you. That is not nothing. That could very well be fibromyalgia, and it deserves proper attention and proper care. Fact 2. The hands are one of the most commonly affected areas in fibromyalgia. Alright, fact number 2, and this one I think brings a lot of comfort to people when they hear it, because one of the most isolating things about fibromyalgia is feeling like no one else understands what you're going through. So let me just say this clearly. If your hands are significantly affected by your fibromyalgia, you are absolutely not alone. The hands are one of the most commonly reported sites of fibromyalgia symptoms, and there are very specific reasons for that. Let's talk about what fibromyalgia actually feels like in the hands, because it is quite unique and quite different from what most people expect pain to feel like. The most commonly reported sensations include burning, and I mean a deep, persistent, sometimes unbearable burning sensation that can feel like your hands are on fire even when nothing is touching them. There is tingling, that pins and needles feeling that can be constant or can come and go. There is numbness, where parts of the hand just feel like they've fallen asleep and won't fully wake up. There is what we call allodynia, which is pain from stimuli that should not normally be painful. So something as simple and innocent as the light pressure of a ring on your finger, or the seam of a glove, or even someone gently touching your hand can feel genuinely painful. That is allodynia, and it is very common in fibromyalgia. There is also hyperalgesia, which is an exaggerated response to things that are normally painful. So yes, that bump or that small injury hurts everyone, but for someone with fibromyalgia it can hurt at a completely disproportionate level. And then there is the stiffness. That gel-like stiffness, especially in the mornings where your hands just feel like they need a long time to warm up and loosen before they'll cooperate with you. Now, why are the hands so particularly affected? A few reasons. First, our hands are incredibly densely innervated. That means there are more nerve endings per square centimeter in our hands than almost anywhere else in the body. And when your nervous system is in a state of sensitization, as it is in fibromyalgia, areas with a higher density of nerve endings are going to feel that amplified pain signal more intensely. Your hands are essentially a high traffic zone for nerve signals, and so when the volume is turned up on those signals, your hands are going to feel it profoundly. Second, our hands are in constant use. Think about how much you use your hands every single day. From the moment you wake up and reach for your phone, to making coffee, to typing, to driving, to cooking, to holding things, to personal care. Our hands are almost never at rest during our waking hours. And for someone with fibromyalgia, that constant use means constant stimulation of already sensitized nerves. Every task, no matter how small, is sending signals to a nervous system that is already overwhelmed and already overreacting. Common triggers that make hand symptoms flare up include cold temperatures, which is a big one. Many people with fibromyalgia find that cold weather or even just putting their hands in cold water makes their symptoms significantly worse. The cold seems to ramp up the nervous system's sensitivity and the pain and stiffness can become quite severe. Repetitive motions are another major trigger. Things like typing for long periods, knitting, playing an instrument, scrolling on your phone, anything that involves repeated small movements of the hands. Stress is a huge trigger, and I will talk more about this later, but emotional and psychological stress directly amplifies pain signals in fibromyalgia, and the hands are often one of the first places people feel a stress flare. Poor sleep is another trigger, and again I'll get deeper into that later, but when you don't sleep well your pain threshold drops significantly and your hands will let you know about it. I want to share something that I think a lot of people can relate to. I've heard from so many people with fibromyalgia who describe waking up in the morning and before they even fully open their eyes, before they've even had a chance to think about the day ahead, their hands are already hurting, already burning, already stiff. And that sets the tone for the entire day. The exhaustion of starting every single day already in pain before you've even gotten out of bed is something that people who don't live with this condition genuinely cannot fully comprehend. And if that is your experience, I want you to know that it is valid, it is real, and it makes complete sense given what we know about how fibromyalgia affects the nervous system. The good news, and there is good news, is that because we understand the mechanism, we can actually do something targeted and meaningful about it. And we will get to that in fact number 5. Fact 3. It goes much deeper than just hand pain, the whole body connection. Fact number 3 is something that I think is really important for people to understand, because it shifts the way you think about fibromyalgia and ultimately shifts the way you approach managing it. And that is this. Fibromyalgia is not a hand condition. It is a whole body, whole system condition. The hand pain is real and it is significant, but it is one expression of something much bigger that is happening in your nervous system and throughout your entire body. Let me explain what I mean. Fibromyalgia is characterized by what we call central sensitization. This is a state in which the central nervous system, meaning your brain and your spinal cord, becomes hypersensitized to pain signals. Under normal circumstances, your nervous system has a very elegant and sophisticated way of filtering and modulating pain signals. Not every signal that comes in gets amplified and turned into pain. Your nervous system has checks and balances, inhibitory pathways, regulatory mechanisms that keep the volume of pain at an appropriate level. In fibromyalgia, those regulatory mechanisms are not working properly. The inhibitory pathways are impaired. The result is that pain signals are amplified far beyond what they should be, and that amplification happens throughout the entire body, not just in one area. So yes, your hands hurt. But your neck probably hurts too. Your shoulders. Your back. Your hips. Your legs. Many people with fibromyalgia describe it as though their entire body has become a source of pain. And this widespread nature of the condition is actually one of its diagnostic hallmarks. The formal diagnostic criteria for fibromyalgia require widespread pain, meaning pain in multiple regions of the body, persisting for more than 3 months. So if you have hand pain as your most prominent symptom but you also notice pain and tenderness elsewhere in your body, that actually fits the fibromyalgia picture very well. Now here is where it gets really important. Fibromyalgia does not travel alone. It tends to come with a whole constellation of other symptoms that are all connected to that same underlying central nervous system dysregulation. Fatigue, and I mean a profound, bone-deep fatigue that is not relieved by sleep, is one of the most universal and most debilitating symptoms of fibromyalgia. Sleep disturbances are incredibly common. People with fibromyalgia often report difficulty falling asleep, frequent waking during the night, and waking in the morning feeling completely unrefreshed as though they haven't slept at all. Cognitive difficulties, commonly known as fibrofog, are extremely prevalent. This includes difficulty concentrating, memory problems, word-finding difficulties, mental fatigue. Headaches and migraines are more common in people with fibromyalgia. Irritable bowel syndrome, bladder sensitivity, and other functional disorders often coexist with fibromyalgia. Anxiety and depression are significantly more common, and this is not because fibromyalgia is a psychological condition, it is because living with chronic pain and these symptoms has a profound effect on mental health, and also because the same neurological dysregulation that drives fibromyalgia pain also affects mood regulation. Now here is the critical connection to your hands. All of those symptoms I just described, the fatigue, the poor sleep, the stress, the anxiety, the cognitive fog, they all directly worsen your hand pain. Let me explain why. When you are fatigued and sleep deprived, your pain threshold drops significantly. The nervous system becomes even more sensitized when it is exhausted. So you wake up after a poor night of sleep and your hands hurt more. When you are stressed and anxious, your body produces cortisol and other stress hormones that directly amplify pain signals. When you are in a state of psychological distress, your nervous system's ability to modulate and regulate pain is further compromised. So your hands hurt more when you are stressed. When you have fibro fog and you're struggling cognitively, the mental effort of getting through the day is exhausting, and that exhaustion feeds right back into increased pain sensitivity. Do you see the cycle? Poor sleep leads to more pain. More pain leads to worse sleep. Stress leads to more pain. More pain leads to more stress and anxiety. Fatigue leads to more pain. More pain leads to more fatigue. It is a vicious cycle that perpetuates and amplifies itself, and if you only treat the hands, if you only focus on the local symptoms in the hands, you are not breaking that cycle. You are putting a small bandage on a much larger wound. This is why treating fibromyalgia effectively, and particularly treating fibromyalgia hand pain effectively, requires a whole-person approach. It requires addressing sleep. It requires addressing stress. It requires addressing movement and nutrition and mental wellness. Not because these are luxury additions to your treatment plan, but because they are absolutely central and essential to it. And that is something I will come back to in detail in fact number 5. Fact 4. Fibromyalgia hand pain, family history, and what triggers it. Alright, fact number 4, and this one tends to really get people's attention. Particularly if you've been sitting in the doctor's office and you've had that moment where you look down at your own hands and you suddenly see your mother's hands or your grandmother's hands. Because fibromyalgia, like so many chronic conditions, has a significant genetic and familial component that is worth understanding. Let's start with the genetics. Research has shown that fibromyalgia does run in families. If you have a first-degree relative, meaning a parent or sibling, who has fibromyalgia, your risk of developing it yourself is significantly higher than the general population. Studies suggest that the heritability of fibromyalgia, meaning the proportion of the risk that can be attributed to genetic factors, may be as high as 50% or more. So genetics is not a minor footnote in the fibromyalgia story. It is a major chapter. Now what exactly is being inherited? Researchers believe that what is being passed down is a genetic predisposition towards central sensitization. Remember that concept from fact number 3? That state in which the nervous system becomes hypersensitized to pain? Well, some people are genetically wired in a way that makes their nervous system more susceptible to developing that sensitization. Specific genes involved in the regulation of neurotransmitters like serotonin, dopamine, and norepinephrine, all of which play important roles in pain modulation, have been associated with fibromyalgia. Variations in these genes can affect how effectively the nervous system regulates and dampens pain signals, and those variations can be inherited. I often think about the conversations that happen in clinic around this. Someone comes in, let's say a woman in her 30s or 40s, dealing with widespread pain, significant hand symptoms, burning and tingling in her fingers, stiffness every morning. And I ask, does anyone in your family have fibromyalgia or chronic pain? And sometimes they'll say, well, my mother always complained about her hands hurting, or my grandmother had all sorts of pain issues but she never had a diagnosis. And then I ask, do your hands feel the way theirs did? And you can almost see the light go on. That moment of recognition. That connection that maybe was always there but hadn't been named. And the reason I think this is important to understand is not to make anyone feel like they are inevitably doomed, quite the opposite actually. Understanding the genetic component helps explain why some people seem to develop fibromyalgia without a clear precipitating event, while others seem to develop it following a specific trigger. Both things can be true. You can have a genetic predisposition towards central sensitization, and have that predisposition activated by a specific trigger. And understanding that dual nature helps us understand the condition better and approach it more effectively. So let's talk about triggers, because this is crucial. Even with a genetic predisposition, fibromyalgia typically does not just appear out of nowhere. In many cases, there is an identifiable triggering event or period that seems to activate the condition. Physical trauma is one of the most commonly reported triggers. A car accident, a significant injury, a surgical procedure. Something that puts the body through significant physical stress, and essentially throws the nervous system into a state of heightened alert from which it then fails to return to baseline. This is why fibromyalgia is more common in people who have experienced physical trauma, including things like repetitive strain injuries, which is relevant to our discussion of the hands. Infections are another well-documented trigger. Viral illnesses in particular can sometimes precede the onset of fibromyalgia. There has been a great deal of attention in recent years to what is being called post-viral syndromes, and the overlap between these syndromes and fibromyalgia is significant and is an active area of research. Significant emotional or psychological trauma is also a recognized trigger. Adverse life events, ongoing or acute psychological stress, trauma history, all of these can contribute to the nervous system dysregulation that underlies fibromyalgia. Other chronic pain conditions can also serve as a gateway. People who have had long-standing pain from conditions like arthritis, endometriosis, or other chronic pain disorders can sometimes develop central sensitization as a secondary phenomenon, where the persistent pain input essentially trains the nervous system into a hypersensitized state. What does this mean for you? It means a few things. First, understanding your family history matters. If fibromyalgia or chronic pain runs in your family, that knowledge is empowering. It doesn't mean you can't live a full and active life. It means you have information that can help you make choices that support your nervous system and potentially reduce your risk of severe symptom development. Second, if you can identify a trigger that seems to have started or significantly worsen your symptoms, that context is valuable for your healthcare team. It helps them understand the trajectory of your condition and tailor your treatment accordingly. Third, and this is the empowering part, while you cannot change your genes, you absolutely can influence the environment in which those genes are expressing. The lifestyle factors that I am going to discuss in fact number 5 are not just nice to haves. For someone with a genetic predisposition towards central sensitization, they are genuinely protective. Fact 5. What you can actually do about fibromyalgia hand pain. And now we have arrived at fact number 5, and honestly this is the one I most want you to take away from this video. Because all the understanding in the world about what fibromyalgia is and why your hands hurt is only as valuable as what you actually do with that understanding. So let's talk about what you can do. And I want to be honest with you from the start, there is no magic pill. There is no single injection or single supplement that is going to make fibromyalgia disappear. But there is a lot, and I mean genuinely a lot, that can be done to significantly reduce your hand pain, improve your function, and increase your quality of life. So let's go through it. Topical treatments for hand pain. Let's start with the most direct and targeted approach, which is topical treatments applied directly to the hands. Now, I want to be clear about something important here. Because fibromyalgia is a nervous system condition and not a joint condition, topical treatments work differently here than they do for arthritis. With arthritis, we are trying to reduce local joint inflammation. With fibromyalgia, we are actually trying to calm and desensitize the local nerve endings in the skin and tissues of the hands. And there are topical agents that can do this quite effectively. Topical lidocaine preparations can numb and calm sensitized nerve endings in the hands. Topical capsaicin, which comes from chili peppers, works through a fascinating mechanism where it initially activates and then desensitizes pain receptors in the skin, effectively turning down the volume on those nerve signals over time with regular use. There are prescription-strength topical anti-inflammatory and analgesic compounds that can be helpful. There are also over-the-counter options including menthol-based creams which create a cooling sensation that can provide real and meaningful relief, CBD-based topicals which some people find genuinely helpful for localized pain and which have a growing body of research behind them, and various other herbal and plant-based preparations. The advantage of topical treatments is that they deliver relief directly where you need it without significant systemic side effects. They are a very reasonable first-line option for managing the day-to-day hand pain of fibromyalgia, and many people find a topical that works well for them and use it regularly as part of their management routine. Oral medications. Moving to oral medications, this is an area where fibromyalgia actually has some specific options that are distinct from what is used for arthritis. Because fibromyalgia is a nervous system condition, the medications that work best are those that act on the nervous system. There are FDA-approved medications specifically for fibromyalgia that work on neurotransmitter systems involved in pain modulation. These include medications like duloxetine and milnacipran, which affects serotonin and norepinephrine, and pregabalin, which acts on calcium channels involved in nerve signal transmission. These medications do not just mask pain the way a painkiller does. They actually work to recalibrate the nervous system's pain processing, which is addressing the actual underlying mechanism of fibromyalgia. Low doses of tricyclic antidepressants like amitriptyline are also commonly used, particularly for their effects on sleep quality, which as we discussed is intimately connected to pain levels. Traditional pain relievers like ibuprofen and acetaminophen can help take the edge off on difficult days, but they are not really addressing the core nervous system dysfunction and should not be the primary strategy. Opioid medications are generally not recommended for fibromyalgia because the condition involves altered opioid receptor function, and opioids can actually worsen central sensitization over time. The important message here is that medication for fibromyalgia should be prescribed and managed by a knowledgeable healthcare provider, ideally someone familiar with fibromyalgia. If you are currently being told that nothing can be done, or that you just have to live with it, or that it is all in your head, please advocate for yourself and seek a second opinion. There are good treatment options available. Hand therapy and targeted movement. Now this is where I want to spend some significant time because in my experience and in the research literature, targeted hand therapy combined with broader movement is one of the most powerful and most underutilized tools in fibromyalgia management. When you have fibromyalgia affecting your hands, you very naturally start to protect them. You stop using them as much. You avoid activities that hurt. You rest them more. And this seems logical. If it hurts, don't do it. But here is the thing. That protective avoidance actually makes fibromyalgia worse over time. When we stop using our hands, the small intrinsic muscles of the hand weaken. The tendons and tissues stiffen. The nervous system, which is already hypersensitized, now receives less normal sensory input from the hands, and this can actually amplify the abnormal pain signals. It is another one of those vicious cycles. Hand therapy, specifically guided by a qualified hand therapist, works to break that cycle. The goal is not to push through pain in a damaging way. The goal is to gently, progressively, and intelligently restore normal movement, strength, and sensory input to the hands. Exercises that work on finger flexion and extension, grip strength, pinch strength, fine motor coordination, and range of motion are all part of a good hand therapy program. And here is what is fascinating. The act of performing these exercises does not just strengthen the muscles. It sends normal, healthy sensory signals to the nervous system. It essentially helps retrain the nervous system, reminding it what normal input from the hands feels like and helping to recalibrate those amplified signals. Warm water therapy is particularly wonderful for fibromyalgia hands. The warmth relaxes sensitized nerve endings and muscles, making movement easier and less painful. Many hand therapists use warm water exercises as part of their program. Paraffin wax baths are another option that can provide warmth and significant relief for fibromyalgia hand symptoms. Now I also want to talk about broader movement, because the research on exercise and fibromyalgia is quite clear and quite compelling. Regular aerobic exercise, the kind that gets your heart rate up moderately, has been shown to be one of the most effective long-term treatments for fibromyalgia. It works through multiple mechanisms. It reduces central sensitization. It improves sleep quality. It reduces cortisol levels. It releases endorphins and other natural pain-modulating chemicals. It improves mood. It reduces fatigue. All of the things that fibromyalgia takes from you, regular movement can start to give back. I am not talking about intense, painful exercise. I am talking about finding movement that your body can tolerate and that you actually enjoy. Walking in nature. Swimming or water aerobics, which is particularly gentle and effective for fibromyalgia. Gentle cycling. Yoga or Tai Chi, which combine movement with breath and mindfulness and have excellent evidence behind them for fibromyalgia. The key is consistency and gradual progression. And regarding technology, there are now some really exciting digital tools and applications that are making hand therapy and pain management more accessible. Apps that gamify hand exercises, allowing you to do therapeutic movements in a way that is engaging and trackable. Telehealth platforms that connect you with hand therapists and pain specialists regardless of where you live. Wearable devices that can help monitor activity levels and guide graduated exercise programs. These technologies are genuinely helping to bridge the gap for people who may not have easy access to specialist care, and I think they represent a really meaningful step forward in how we support people with conditions like fibromyalgia. The pain pathway revolution. You are not destined to suffer. And now I want to finish with what I think is the most important and most hopeful piece of this entire conversation. Because I need you to understand something that has genuinely changed the way we understand and treat fibromyalgia. And that is the distinction between the condition itself and the pain. Having fibromyalgia does not automatically mean you are destined to a life of severe hand pain. I know that might sound surprising or even hard to believe, especially if you have been suffering for a long time. But please hear me out, because the science on this is real and it is genuinely hopeful. We now understand that the pain pathways in fibromyalgia are not fixed. They are not permanent. They are not hardwired in a way that cannot be influenced. The nervous system has something called neuroplasticity, which means it can change, it can adapt, it can be recalibrated. And there are specific, evidence-based lifestyle factors that have been shown to actually modulate these pain pathways and reduce the sensitivity of the nervous system. Sleep, and I will never stop emphasizing this, is perhaps the single most important factor in fibromyalgia pain management. The relationship between sleep and fibromyalgia is bidirectional and profound. Poor sleep worsens pain. But more importantly, improving sleep quality can significantly and measurably reduce pain. There is research showing that people with fibromyalgia who achieve better sleep quality experience significant reductions in pain intensity. So prioritizing sleep hygiene, addressing sleep disorders, and finding strategies that help you achieve deeper, more restorative sleep is not a secondary concern. It is a primary treatment strategy. Movement, as I discussed, is medicine. Not just hand exercises, but full body movement that you genuinely enjoy and that gets your heart pumping. Research on fibromyalgia and exercise consistently shows that people who maintain regular physical activity have better pain outcomes, better function, better quality of life, and lower medication needs than those who are sedentary. Find what moves you, literally and figuratively, and do it as consistently as you can. Stress management is not a soft or vague concept in fibromyalgia. It is a neurobiological imperative. Chronic stress maintains the nervous system in a state of high alert, which directly sustains and amplifies central sensitization. Cortisol, the primary stress hormone, directly modulates pain pathways. Practices that reduce psychological stress and lower cortisol levels have a direct, measurable effect on fibromyalgia pain. Meditation, mindfulness practice, deep breathing, time in nature, creative pursuits, therapy and counseling, journaling, these are not just nice things to do. They are legitimate and powerful tools in your fibromyalgia management toolkit. Relationships matter more than most people realize. The quality of our social connections has a profound impact on our pain experience. Supportive, nurturing relationships activate calming neurological pathways. Isolation, conflict, and toxic relationships amplify stress and pain. Surrounding yourself with people who understand, support, and uplift you is not just good for your mental health. It is genuinely good for your pain levels. And nutrition, a healthy, varied, anti-inflammatory diet, rich in vegetables, fruits, whole grains, healthy fats, and quality protein, supports nervous system health, reduces systemic inflammation, supports gut health, which is intimately connected to nervous system function, and provides the nutritional building blocks your body needs to regulate neurotransmitters and pain pathways effectively. Reducing ultra-processed foods, excessive sugar, and alcohol is particularly important, as these can amplify inflammation and disrupt sleep and neurotransmitter balance. All of these factors, sleep, movement, stress management, relationships, nutrition, work synergistically. Each one supports the others. Improving your sleep makes it easier to exercise. Exercising regularly improves your sleep quality and reduces stress. Reducing stress improves your nutrition choices and your sleep. Good nutrition supports your energy and your mood. It all connects. And each positive step you take in any of these areas creates a ripple effect that benefits the others. OUTRO. I hope that this video has given you a clearer, fuller, more empowering picture of what fibromyalgia in the hands actually is and what you can do about it. You now know that fibromyalgia is not the same as arthritis, that your hands are one of the most commonly affected areas precisely because of how densely innervated they are, that this is a whole body nervous system condition and not just a hand problem, that genetics and triggers play a role, and that there is genuinely a great deal you can do to reduce your pain and improve your quality of life. You are not imagining your pain. You are not weak. You are not beyond help. What you are is someone dealing with a real, recognized, treatable condition that affects millions of people worldwide, many of whom are finding ways to live well and live fully. Please take a moment to share this video with anyone you know who is struggling with fibromyalgia or who has been dealing with unexplained hand pain, burning, tingling, or stiffness. You may be giving them a piece of information that genuinely changes their journey. And if you have questions, leave them in the comments below. I read them and I want to hear from you. If you like this video, please hit that like button. It truly helps us reach more people who need this information. And if you haven't already, please subscribe to the channel because we are going to keep bringing you content like this, honest, evidence-based, whole-person information about fibromyalgia, chronic pain, and everything connected to living and thriving with these conditions. Because here, we believe it is all connected. Take care of your hands. Take care of your nervous system. Take care of yourself. And we will see you in the next one.